you? Welcome.
Robert.
I'm Dr. Karadeniz. Nice to meet you.
Nice to meet you as well.
Let's have a look. How old are you?
I will be 40 in June. Oh, 39.
Okay. How did you find about our clinic?
So I got through the internet, got through all the, let's say, reviews, Trustpilot, everything. Went to on the site, the hair restoration, we are part of. And so what are the doctors in Istanbul part of the...
So you looked into everything.
I talked about 50 clinics in Istanbul.
Oh, it must be tiring.
Yes, there are too many.
Yeah.
And you don't know where to choose from, so...
Yeah. The first thing one needs to realize is that there are two different markets. One is a fake hair transplant market, other is a real hair transplant market. Fake hair transplant market is 99% of the market, real is less than 1%.
Okay.
What is the difference between fake and real? In the fake hair transplant market, there is no know-how of hair restoration surgery.
Mm-hmm.
These are basically marketing and sales companies.
Okay.
The labor, the know-how is outsourced. It's outsourced.
That's not good.
Okay? So they can recruit people walking around, many hundreds, but in reality, there is no real know-how produced in the company. Okay? No name teams are performing. In the real hair transplant clinic, there is a surgical team creating the know-how in that company.
Mm-hmm.
They have their own know-how, so they don't use any outsourced labor. This is 1%. So this is difficult to figure out because you look at many things, none of these things show you the difference between fake and real.
Yeah.
This is the difficult part.
Yes.
But anyhow, you have it here. So let's celebrate it. So let's begin. Now, what I see is you are having diffuse thinning all across the top, okay?
Mm-hmm.
But strategically, the hairline and the frontal density is cosmetically the priority, okay?
Mm-hmm.
Density in the hairline and this frontal area is a priority. So, what I suggest is as follows. The purple line shows you where I want to put the hairline.
Mm-hmm.
I don't want to lower it anymore from there. And I want to thicken this area here, which I believe is the priority of this procedure in this area.
Okay.
Okay? And then spread the remaining hairs evenly into the remaining mid-scalp and crown.
Okay. So we're working mostly on this side, but also on the...
Yes,
on the
but
next
most important goal is to achieve the density here because you lost the definition of the hairline. When we look here, we can see through, actually we can see through up to here.
Yeah, that's true.
So we need density in here where we cannot see the skin anymore.
Mm-hmm.
Okay? And then go into here. Obviously you have continuous hair loss.
Mm-hmm.
So if you don't want to keep running to the hair transplant clinic and having a hair transplant every year, maybe you can consider using hair loss medicine to protect your existing hairs. Okay? Because if you don't, every year some of this hair will be lost. Okay? Which means you will keep needing to transplant more hairs in this zone forever. So if you want to like extend the gap between two transplants, maybe you can consider hair loss medicine. Okay?
Like finasteride, right?
Finasteride, minoxidil, yeah.
I saw a lot of from the internet right now regarding dermarolling and microneedling. What is your opinion?
Why? What's the point?
For the blood to flow into the scalp.
So first we have to ask, is there a lack of blood flow in the scalp?
I don't know. Maybe.
Answer, no. Scalp is the best area in the body with the highest possible blood flow.
Okay.
There is nowhere in the body. It's the scalp, face, and genital organs that get the most blood flow.
Okay.
So why do we need any blood flow?
Okay, understood.
It's a scam.
It's a scam.
It's a scam.
Okay. Yeah.
Secondary, other benefits hoped from microneedling, used in other purposes, is to trigger wound healing and regeneration. Like for instance, if you have an aging face, okay, wrinkles, they consider microneedling. So in theory, it has a point. The point is to make micro wounds to trigger regeneration of the skin.
Okay.
But in scalp, we don't need any regeneration of the skin.
Yeah.
We need the hairs protected from DHT.
Yes. Yeah.
We do, by giving it, providing it more blood flow, or microneedling and more triggering regeneration, you are not reducing the effects of DHT. Maybe you are even increasing it.
Okay.
Because DHT is carried by blood.
Of course. Yeah.
So you cannot stop DHT by increasing blood flow. The only thing by stopping is to use medicine that blocks
DHT.
Yes.
Understood. Okay.
Scammy marketing is free to say whatever they want. They don't care about claim, hypothesis, proof. Say whatever you want.
Yeah.
What's the logic behind it? No logic.
Yeah. This is why I wanted to ask you, because I've seen it on YouTube, a lot of examples doing it. Yeah. This is why I wanted to ask a professional opinion about it.
Yeah, because companies want to sell something. Okay? Medicine is not sold by companies, it's sold by chemists.
Yeah.
So they look for any way to convince people not use medicine, which chemists provide, so they can sell you something.
That makes logic.
That is logical, right?
Yes.
Okay.
Yes.
Okay. So agreed with the plan?
Agree. One more thing I wanted to ask about this line. Can we go a little bit down a bit? Like I don't know, like half a centimeter, 1 centimeter?
God, please, one patient doesn't ask me the same thing.
I'm just...
Now, in hair transplant, there is no such thing as can we.
Okay.
We can do whatever we want. Let me ask you one question.
Please.
Can we transplant hairs under my foot? Can we?
Yes.
Yes, we can. So what's the value of this question? Can we? Yes, we can.
Okay. But why do you not recommend it?
Should we?
Should. Yes, should.
Should we? Okay. Obviously no, because if we should, that's how I would design it. My design shows what I think we should be doing. For some reason, it's very wide widely spread within unprofessional clinics and a lot of patients to want an unnatural hairline that doesn't exist in nature. Okay? Male hairlines are quite sharp and open in the temporal recession areas. Blunted and rounded temporal recessions are both extremely unnatural and they don't exist in mature men. They exist in children and girls and females, not in mature men. I don't understand why men want to be like children or girls.
No, the reason I asked that question is I was just looking at my previous hairline because it wasn't in my previous, before you start losing the hair.
When you were 12 years old?
No, when I was, I don't know, 5 years ago, 6 years ago.
No, it cannot be. You did not have a rounded hairline 5 years ago, 6 years ago. You had a higher density here, okay? Your hairline may be lower than this, but not rounded and blunted in the corners.
Yeah, no.
Doesn't exist in nature.
Yeah, not rounded. I was asking, it was a little bit done back in
So there's another thing here about hair transplant surgery, okay? A lot of people think the goal of a hair transplant is to bring back one to how they looked 10 years or 20 years ago. This is absolutely wrong. Let me tell you why it's wrong. So, hair transplant surgery is not for going back in time. For two reasons. One is we only age forward. We never get younger.
Yeah.
So, what we do is permanent and should fit in with aging. It cannot fit in with someone who's extremely young. The second thing is that in hair transplant surgery, we are not adding new hairs. We are just redistributing what's left.
Yeah.
So the design is not going back to an existing appearance. It's redoing the hair with half of the hairs left. Yeah. That's why the goal of hair restoration surgery cannot be how we used to be in the past. It's an entirely new design with what is left.
Okay, got it. Understood.
Imagine having a hairline like when you were 17 and you bend down and there is an area like a football field with no hair.
No.
How natural does this look?
No, it doesn't look.
Yes. Why? Because this type of approach doesn't take into consideration the material. We are limited with our material. And that's why instead of having a very low and blunted hairline and no or little hair behind it, it's best to have it higher and more receded, but more complete behind it.
Understood. And my next question is, how do you determine how many hairs do I need to take from my donning area and put it in my front?
One, by experience. Okay. What does the experience include? Okay.
Yes.
One, it includes the average head size, donor area size, donor density, average. A little bit differences between people, but on average, okay? Average working time in one day, which is about 8 working hours. And time consumed for each step of the procedure with good quality. Because if you rush it, everything will change. But if you want to do quality, then you have to spend a reasonable amount of time. So this is a frequently asked question. So I will go 1 minute more in detail here. How do I determine? Okay? Now, we are taking units. Units contain one or more hairs, which we call grafts. Okay? These units. Now, imagine we have 8 working hours, okay, and we have 3 main steps of the hair transplant.
Okay.
Donor harvesting, taking those units, recipient site incisions, making the holes for the grafts, and placement, putting the grafts in. Okay, 3. Of course, in between you have local anesthetic, breaks, toilet breaks, food and drink breaks, all of those also. 3 main steps. Okay, and we have 8, sometimes 9 hours to complete this. Okay, we can't do a surgery for 15 hours. So we have to. So we take the hairs, okay? If we want to take 2,000 to 3,000 units, okay? And if we want to do good quality, we spend 3 hours doing this. Okay? 3 hours. Of course, you can do it in 10 minutes if you want. If you want to waste 80%, you can do it in 10 minutes. But if you want to do it properly without wasting the hairs, okay, then it takes us 3 hours. Then we do the recipient sites. 2 to 3,000. Again, if you do carefully, not like a machine, it will take at least 1 hour. Okay, 4 hours. And if we want to place these grafts with 2 or 3 people at the same time, it will take another 3 hours, 7 hours. Include lunch break, toilet break, tea, everything, 8 hours. As you see, also this week. Now, there are companies, they will take 5,000 units in 20 minutes. Then it changes. You have to see what quality these units are. They are 70-80% dead and wasted. Okay? So the patient's average head, size of donor area, the density, okay, tissue difficulties, working, all these come up with an average number. Few hundred less or more, but average from experience. This is how we determine.
Okay. I wanted to ask because a lot of companies, as I said, I talked with many other clinics, and they told me about 4,000 to 5,000 grafts.
Yes, so graft is a marketing tool for fake clinics. It's a marketing tool. It's a tool. Because you are not going through surgery to buy grafts. You are going through it to get a result.
Of course, yes.
You are not buying graft, you want a result, okay?
I want my hair.
Yeah, you want hair and you want a result. So there's an opposite relationship between grafts and the result. More grafts, less result.
Okay.
Because there is more damage, careless surgery, wasted hairs, scarring, damage to the underlying blood vessels, nerve endings, everything. Okay? So more grafts, less quality. The quality is the know-how and time given for each unit. If each unit is given 5 minutes overall, this is quality. If each unit is given 30 seconds, overall, it's lower quality. Since we cannot extend the working hours to 16 hours, it means it's rushed. Okay? And also, there is tissue limits. Because every time you make a wound, you are damaging the tissue. So in a way, the tissue doesn't want to be damaged. Okay? And if you damage it too much, you have many consequences. Wasted hairs, poor growth, even skin necrosis, it doesn't get enough blood supply. That is when you don't get enough blood supply. Too many wounds, wasted hairs. So, and you cannot recover it. There's only one donor area, and when it's wasted, it's finished. So one of our most important values at AEK is the preservation of donor area. In the fake industry, and mind you, the industry is a handshake between companies and patients. They agree. The 6,000 graft industry, the fake industry, okay? So in this industry, they see the donor area as the enemy. But the donor area is not your enemy.
Yeah.
It's your friend. It's your dear friend. But they see it as the enemy. So I see some patients say, doctor, take everything. What do you mean take everything? It's not your enemy. They think they are going to avoid needing more hair transplants by, no. In the contrary, you waste the donor bank and you cannot use it again. Maybe you get a little bit more hair, but you lose all the chances of having more hair transplant. Instead, if you do it at high quality, you can get 3, 4, 5, 6, 7 hair transplants in your life. Some people, because they think, oh, they want to get it all at once, and the clinics know it, so they say, oh, we're going to fill it 6,000 grafts. It will be full. You'll put gel. Because they want to sell you one hair transplant only once. They don't need you again. One shot. Whereas the quality hair transplant industry, the relationship between patient and clinic continues for many years. 3, 4, 5 hair transplants.
Yeah.
In the low quality fake transplant, once and finished. Goodbye.
Yeah, and that's not good.
I think so. I agree. Okay? Any other question?
One last question from my side. So you said we are gonna put a lot of hairs on this side. How you are dealing not to damage the remaining hair?
By experience.
Okay.
One, that's the simple answer.
Okay.
But if you want to go a little bit more sophisticated in this question, is that whenever you are transplanting between existing hairs, you are always risking the damage of the existing. This is why the decision to transplant an area or not is a trade-off. This is why in mild hair loss thinning situations, I don't recommend hair transplant because the amount you have to weigh the amount you can add versus the risk of damaging existing hairs. Okay? So if you cannot add a lot of transplant hairs, like maybe you can add 10-20% more, it's not worth it. Because you can damage 10% and there is no profit.
Yeah.
This is why to make it worth it, it must be a significantly thinning zone, like prefrontal zone. Can some of the existing hairs be damaged? Yes. But you would have to stay bald forever if you fear that. So you risk some of that. See, the damage to existing hair is not just direct damage on it. Sometimes because you are cutting in between. It's like throwing a hand grenade, hand bomb, somewhere, and soldiers far away can fall as well. So if you make incisions into grafts, sometimes there are some hairs ready to go. Maybe next year or in the next 2 years, they're going to go. And when you do the transplant, you say, okay, we're going to go now. So they go. There is this risk. This is why you need the donor area preserved for when you need it again. And this is why the decision to transplant should be where you are significantly thinning. And because you asked, I could say, it is possible to just transplant this zone in the front and do nothing to the back. This is also one way to do it. A lot of patients don't like this idea, but just because you ask this question, you can see the logic behind it, because this area is significantly thin. This area is thin too, but not as thin as the front. So now the risk-reward ratio is less. Maybe by just using medicine, you can keep it for 5 years. So see, it's a different mindset. A lot of people, they want to do it once, finish it all, never need it again.
to be easier for.
Yeah, but it's not reality. This is not the truth and nature. The truth is to go carefully, use the donor bank economically, and to do as little as possible in every visit and go step by step. Think twice before using every donor hair. Okay? But this is a more sophisticated mindset. It requires understanding that I may need 3, 4, 5 hair transplants. It'll be more costly, more visits, but this is the fact. It's the truth. So one way of approaching is to just do this and not touch the mid scalp and crown, and it has its logic. Maybe if I did it on me, that's what I would do. I would just transplant my frontal zone, and I would wait maybe a few years before I do it. But this is against the logic of wanting to get the most in one visit. It's prioritizing donor capacity over time and money.
Yeah.
It's a personal decision.
Of course.
Okay.
Yeah. Okay.
Okay?
Okay.
Like the plan?
Yeah, I will sleep on it and
Yes.
after tomorrow to see if I'm okay with the lines. If not, I'm thinking maybe we can redesign it a little bit lower.
Yes. So see, here's one last thing.
Yes.
Some surgeons
Yes.
refuse to do designs that they don't believe.
Okay.
But because most of my patients come from overseas,
Yeah.
practically I can't do that because I see them the first time just before the surgery. And if I said, oh, I refuse it, it's a problem.
Yeah.
So I don't refuse it. I will do whatever the patient wants, but I will try to tell them why I want it this way. And still, if they want a different design, which I don't believe is the best, we will do it. But I will give a signed consent that you want a different design than the doctor's recommendations, and hence you take the long-term responsibility for it. Okay? So think over it tonight, and if you still want to change it, tell my friends, and they will give you a pen, and you can draw it. And
I don't know how to draw it.
only you can draw what you want.
Yeah.
I can draw what I want, which is this one.
Of course.
Okay?
Yep.
Alright, see you tomorrow.
Thank you very much.
You are welcome.